Hour with Khan. My name is Moji Arilefela. I'm a consultant psychiatrist locally, working with the general adult age group based with the community mental health team. So I will have the pleasure of hosting this presentation today. We have a very knowledgeable, highly interested speaker today who will be talking to us about understanding metabolic syndrome and men. What is metabolic syndrome? Who does it impact? What are the risk factors? Meanwhile, I can see that there are some regular viewers amongst us. I really welcome you all, regular viewers. At the same time, I'll also like to welcome you if today is your first time that you are joining the Health Hour that's been organized by CAFIP. The CAFIP is Caribbean and African Targeted Health Improvement Program. It is a health education program for all Black people. We are aiming with CAFIP to make readily available, useful health promotion information, which, if taken into practice, it can improve the health of our community members. And I would want to know that people who have been attending this health hour over the past, we've done like 26 different topics, health-related topics to individuals. I like to, imagine that they have taken some steps to improve on their health. CAFIP is brought to you by CAN and its partners. CAN is a Caribbean and African health network. And the partners are the Rafa International Agency, the Croydon BME Forum, the Royal Assembly RCCG Church Sheffield, and the Black Health Initiative. So we're here today to present you another interesting topic, which I know that you'll find informative. I would advise that you encourage friends and family to join you in this hour, and also for you to make spurious notes, because the information Dr. Joe will be sharing with us can be transformational. We will be having knowledge imparted to us, but then knowledge without action is equal to zero. So please take notes, and feel free to use the chat box to send in questions and comments. But prior to that, we would like to know how far and how near you are that you're joining us on this program today. So please put in the chat box, your name, where you're listening in from, and whether someone is with you. We would really like to know. It helps us understand how far or wide or near our audience is from. So please join me as I welcome Dr. Joe Omofuma, who is a GP locally and has a special interest in mental health, who will be giving us this presentation on metabolic syndrome and men for the next 40 minutes or so.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAFIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Well, good morning. Thank you for the lovely introduction, Dr. Moji. And thank you everyone for joining in. It's always good, it's always a pleasure to be here. I always count it a privilege and an honor to be able to share some time with you. Today, as many of you may know, I'm broadcasting from Manchester, where it's always sunny, right? Except today. So you're welcome to the today's program. Yeah, if you believe that, you'll believe anything. But Manchester is not always sunny. So I'm glad I could join you. My name is Joseph. I am a GP here in Manchester with special interest in mental health as well as reproductive health. I wear a number of hats. I see myself as a part of CAN. I love the work that is going on here with CATHIP. And so it's always a pleasure to be with you. This whole month, we will be focusing on men's health, at least for the greater part of this month. And so that influences or that informs today's presentation, where we'll start off with a very interesting topic, which I have sort of coined metabolic syndrome and men. I call it interesting because while it is, very, very common and very important, it's something that's not always spoken about. Please let us know where you are, joining us from. It's always good to know where people are joining from. I know when we started these talks a few years back, we used to have about 15 or 20 people, maybe 30. Now we have sometimes well over 100. So let us know where you're calling from. You can ask questions in the chat boxes. You can ask questions via YouTube. I will only speak for 20 minutes, I promise. And then we'll have room for questions. That's what we like to do. So as I always say, most of these topics are very, very broad. What we try to do as health professionals is to put it in a package that is easy to understand, put it in a bite-sized box. And so today we'll just be going through an overview of what and then if there are questions, we can always delve into it. Fantastic. Somebody's texting or calling from sunny Sheffield. I like the spirit of that. From Lagos and from London. That's great. I haven't been to London in ages. I'm sure the traffic is still as bad as what I remember it to be. All right, so I'm going to be sharing some slides with you. Let me know if you have questions, put it in the chat box. Our team will pick it up. If you're on YouTube, please put your comments in. I have a little quiz for you as well, so we'll try and make it as interactive as possible. Brilliant. So let's go. Right, so I hope you can all see my slides. I'll just project that up. Brilliant. So today I've said it's metabolic syndrome and men, and I'll explain why. By way of introduction, metabolic syndrome is also used to be known as syndrome X, by the way. A cluster of biochemical and physiological abnormalities associated with the development of cardiovascular disease and type 2 diabetes. Now that's the Oxford Dictionary, believe it or not, definition, and it's way too complicated. Basically, I've tried to simplify it by saying my definition is that metabolic syndrome is not a disease itself. Instead, metabolic syndrome describes a group of risk factors, such as high blood pressure, high sugar, unhealthy cholesterol levels, and abdominal fat, that increase our risk of having strokes, heart attacks, and type 2 diabetes. So the first definition is the very academic one. It's a cluster of biochemical abnormalities and physiological abnormalities which are associated with development of cardiovascular disease. But by and large, it's not a disease in itself. Instead, what we're talking about today is a group of risk factors which actually predispose or lean into increasing our risk of having heart attacks and strokes. And we'll sort of expand on that. According to the International Diabetes Federation, metabolic syndrome is can be diagnosed as having anybody with a large waist and any of the two factors listed below. And I'll list them below. Please notice that in your surgery, especially if you're in the UK, and in many parts of the West, really, a lot of times we use BMI, the basal metabolic index. Now, the BMI is gradually going out of fashion because there are certain limitations to it. This came to light in the COVID. I was privileged to be part of a working group that drew up, if you like, a risk assessment tool for Black and ethnic minorities, because that wasn't available at the time. A risk assessment, because you see, the reason why we have some of these health talks is that there are certain health conditions that are quite specific to Black and ethnic minority. For example, our kidneys don't work the same. Certain blood pressure tablets work better for Black people than others. And just to give you an example, so the BMI itself has limitations because it doesn't take into account age, sex, ethnicity, and muscle mass. All those things can affect your BMI. So it doesn't distinguish quite clearly. So what is in fashion now is using your waist circumference. And it's talked about a large waist with any of the two factors. I'll give you an example. I don't want to go too far. This slide, I hope, helps to clarify things a little bit more. If you just let people in the waiting room, I see about 20 odd people waiting. Let's get people in. Let's allow them to be a part of the talk. Now, this defines metabolic syndrome quite graphically, because basically you're looking at a large waist or increased waist circumference or belly fat, as well as increased triglycerides, elevated blood sugar, high blood pressure, and then also low HDL. That's your so-called good cholesterol. Now, when you get your cholesterol result here in the UK, when you get your cholesterol result, there are 4 or 5 parameters that are in that test. You have your total cholesterol, which for most labs, because I've been to certain parts of the UK where it's different, but for most labs in England and Wales, it should be less than 5. Your total cholesterol should be less than 5. There's also your cholesterol, your total cholesterol ratio to your HDL ratio, which again should have a certain figure. Now, within that blood results, you have high density cholesterol, which is your so-called good cholesterol. You have your low density cholesterol, which is your LDL, which is your so-called bad cholesterol, and you have triglycerides. Each of these have risk factors independently of your total cholesterol. So for example, a low HDL, or let's just call it good cholesterol, all right, for the purpose of this presentation. Low HDL will predispose you to having a heart attack and a stroke, even if your total cholesterol is normal. Having high triglycerides has been shown as a very significant risk in people that have myocardial infarctions, that's heart attacks. So you can see that while, generally we talk about, blood test and blood test, because sometimes people come to me and say, I want a blood test. And I'm like, what does that mean? And what do you even know what we are looking for in some of the, so sometimes you need to be able to pinpoint and explain where is the issue here, what's your family history, etc. And that would help us to be able to determine. So a large waist with an increased waist circumference, high triglycerides, elevated blood sugar, high blood pressure, all these things are how we diagnose metabolic syndrome. Why are we talking about this? Estimated that 1 in 3 adults over 50 in the UK at some point is developing metabolic syndrome. All right, that's quite a lot, nearly 30%. In my books, that's a lot. It's shown to be more common in Black, Asian, Hispanic, and Native American people. Now, the risk actually increases with age. So the older you are, the more the risk increases. Doesn't mean you can't get it when you're younger than 50. It just means that as you grow older, there is an increased risk. Interestingly, even though we're focusing on men, the incidence is slightly higher in women compared to men. But here's the problem. We're shining the light on men today because men are usually slow to the uptake. Men don't like coming to GP surgeries. Men don't like coming to get checked out. Men like to hide their problems. And I'll try and highlight some of the reasons why I've seen a lot of men not do that. But we're focusing on men today, but to all intents and purposes, this can happen in both men and women. It's actually much more common in women. It's about 55, 60% to 40%. It's almost that sort of ratio. All right. Men don't like asking for help. Why? Now, you can add your own reasons. I would love to know what your own experience has been. But these are some of the most common reasons that I have seen when I talk to men, because we're talking about men's health today, not because we are discriminating against you lovely ladies, but it's men's health session. Most men are averse to seeking out professional help. Men just don't like. Have you ever seen when you order something from IKEA or Amazon, and the man automatically goes straight in with his tools? He doesn't read the manual. He doesn't ask anybody. We don't know how to ask for advice. And that's part of the problem. Men are not very good at seeking out health professionals. There's a number of reasons. Please add your own reason to the chat. Culture plays a large part of it, where men all over the world, right from when we're little boys, we're taught to be macho. You know, boys don't cry. I don't know if you've ever heard that. I heard that all my life. Boys don't cry. Ego, upbringing is part of it. You want to be macho. There is a false sense. I've put here false sense. I should put that in parentheses or in quote. False sense of not wanting to show weakness. What I call toxic masculinity, because there's nothing wrong in showing a bit of weakness. As a matter of fact, the most emotionally intelligent men are men who understand that they have weaknesses and that they need help. And that's just the truth. Emotional intelligence is another conversation that we perhaps have. But there are some legitimate reasons why some men don't seek help. Most men are the breadwinners, work long hours, etc. And by the time they close, GP surgeries are not open. Allegedly, most of us GPs are on the golf course playing golf anyway. So how can you get an appointment when we are playing golf and watching EastEnders? I would like to know, according to the Daily Mail, that is. But what I'm thinking now is I would like to know those GP surgeries so I can apply there and play golf and watch EastEnders. But that's a separate conversation. But men work longer hours on the average. Not that women don't work long hours, but men tend to be the main breadwinners. I've put here a quote that I gave in a talk years back, and I thought it was pertinent to this. Most men look after their cars better than their bodies. Most men look after their auto vehicles. But is it true or false? Please let me know in the chat box what you think. Because I know some brothers who will not even allow their wives to drive their car, never mind anybody else. And, but we'll talk about that. Let me know what you think. What are the risk factors for metabolic syndrome? Genetics plays a large part, and sometimes there's not a lot you can do about this. Now, I was in a dinner conversation with some people some time back, and, the lady was quite scathing in her criticism of overweight people and saying, oh, they need to exercise, they need to do, and I thought to myself, you can't say that because not everybody who is overweight by choice. There are some people that, it's genetic. They don't eat a lot, but they put on weight anyway, or they struggle to lose weight. Mine is very simple. It's because Man United is not winning, and I'm eating a lot more carrot cake. That's why I'm a little bit overweight. But for some people, there are genetic reasons behind that where they actually struggle, or they may have an underlying problem. They may have a thyroid problem that slows down their metabolism, and that could be the reason why they're not. So genetics plays a very important part in providing a risk factor. Sedentary lifestyles. Some of us are sat on the computers all day, like working from home and all of that. Just even when you're sat in a desk job, it's recommended that every 2 hours or so you get up and walk around. It's good for your back. It's good for your legs. It's good for your circulation. Diet plays a very important role especially for us Afro-Caribbeans. We fry everything. My goodness, we fry. You know, when I was growing up, I used to love going to my grandma's because she had all this stuff that was, oven cooked and stuff. But in the city, it's all fried and fried. Our diet played a huge role. Very important. Lack of exercise, very important. There are certain types of cholesterol, for example, the so-called good cholesterol, that will not go higher, will not go better without exercise. Please write that down, take it to the bank. You can do all the dieting you want. You can watch all the type of food you want. If you don't exercise, certain types of cholesterol will not improve. And that's fact. Poor sleep pattern is very important. Research has shown that reduced amount of sleep actually predisposes people to having heart attacks and things like that. Of course, all the usual culprits, drugs, alcohol, smoking, those things are also important. What is the problem with syndrome X or metabolic syndrome? It used to be called syndrome X when I was in medical school, nearly 30 odd years ago. It's changed to metabolic syndrome. And there's a lot of research still going on in this area. But the main issue is that there are severe cardiovascular risks, and as well as endocrine risks. So basically, there's a risk of stroke, heart attacks, having an enlarged heart, having heart failure, type 2 diabetes and its problems. Nowadays, diabetes is so well controlled that we almost despise or look down on diabetes. But diabetes is a bad boy. I mean, diabetes is not a good disease for anyone to have, because if you don't look after diabetes, I have a couple of patients who've had their legs amputated because of poor diabetic control. I have people who've developed kidney problems because of poor diabetic control. I've had people who've ended up having blood clots, all sorts of problems. Again, having metabolic syndrome leads to having a poor quality of life in later years, which is not a good thing when you've worked hard all your life and then to become poorly. Also needing to be on several lots of medication, which a lot of people don't particularly fancy. Having kidney problems, like I mentioned, etc. So what is the way to deal with this? Or how do we begin to tackle this? Basically, the two key areas of dealing with metabolic syndrome is weight reduction and increased physical activity. And they're not necessarily the same thing. Weight reduction, increased physical activity. You see, research suggests that with diabetes, 10% of weight loss, if you lose 10% of your body weight, can actually reverse, in certain cases, diabetes. So people who have become diabetic, they lose 10% of their body weight and they're no longer diabetic. There's still an ongoing research and back and forth regarding hypertension, because people are finding that in some cases that is also the case. What we find with Black ethnic minority patients is that most of us, unfortunately, we don't listen to talks like this, or we don't take heed. Then we develop the condition. Then we do worse. Then we don't take medication. Some of us will say, your religion, or like one lady said to me, she needed to ask her pastor before she could take blood pressure tablets. And, it's the same thing with some Muslims as well. They believe it's wrong to take medication. So here is the thing. If you're like me and you don't like taking tablets, if you're like me, you don't like taking tablets at all, then the best way really is prevention. So let's begin to look for ways. Most of these things are better prevented rather than allowing these things to set in and then causing problems. But by and large, it's a double whammy for a lot of Black ethnic minority people, because we have to be careful, because we are more at risk. All right. So weight reduction, increased physical activity. My definition of exercise is any activity that raises your heart rate above 100 for at least half an hour. Or any activity, because I met a lady once, she was only like 45, all right? And she was saying, oh, I'm in the kitchen all day. I'm busy with the children. Is that not exercise? I'm sorry to disappoint you. While that is good, at least you're not sedentary, you're not sat in one place. You have to make your heart work a little bit. And it's actually better to do 30 minutes every day, or 30 minutes 4 or 5 times a week, rather than doing 2 hours at once. I have some friends that they go with enthusiasm. The doctor said we must lose weight. You do 2 hours one day, and then we don't see you again for another week. It's better to do regular small exercise. And even the cardiologists are now saying walking is better than running. So anything at all that will raise your heart rate and get your heart pumping is better for your circulation, is better to prevent illness, better to prevent dementia. It makes your brain sharper, makes you more productive, etc. But by and large, the way to prevent a lot of all these risks that we mentioned is weight reduction and increased physical activities. There are other things that we can do. I mean, you can recognize it early, create lifestyle changes. Those of us who smoke, we need to look at that. Alcohol is a big factor. Alcohol actually contains a lot of sugar. So a lot of people who drink a lot will find that, I try, I do a lot of things, but I'm still putting on weight around, the midsection. It's alcohol. Alcohol contains sugar. So you find that a lot of the things, some of the habits and things that we do are not working in our favor. And all these things with moderation. I'm not saying you should not drink at all. If you must, I don't drink. It's personal choice, but if you must drink, then please be careful. For men, I think it's changed recently, but the last recommendations is 14 units for the whole week. For women, 14 units, for men, 21 units. As long as you don't go over that, you're kind of okay. But I don't have the exact numbers now. Of course, the way to treat this, you can use medication. We can pick the individual risk factors, and that's what I'm going to try to do in the course of the questions. If there are questions regarding individual risk factors, we can look into it and perhaps discuss it more if there are questions. Generally speaking, men over the age of 40, I would even go as far as saying 35. Because in my family, for example, my own personal family, there's diabetes and hypertension. So from the age of 35, I started getting yearly, 2 yearly checks. So you should get checked every 2 or 3 years. If you are on any medication, you should definitely get checked yearly. Now, I put a question in the chat and said, men look after their cars better than themselves. True or false? See, men in this country, you have to get an MOT every year. Isn't that right? So if you're a man or if you are over 40 and you're getting an MOT every year, I want you to gather here and let's talk about it. So thank you. That is my brief spiel on metabolic syndrome. I've tried to keep it simple and we can take some questions and have a conversation. I've got Dr. Moji there to help us with that.
Thank you very much, Dr. Joe. That was very broad, elaborate, engaging. We've stayed with you right through. Sometimes people switch off on some topics. But my dear audience, did you hear what Dr. Joe said? I just love him because he's so transparent and a honest man. He said that he does not like taking tablets. So when you hear a GP saying that I do not like taking tablets, what does that tell you? Because in the health organization, in the health business that we're in, many people, we're writing medication for them, we're prescribing medication, but it doesn't have to get to that point. So do what you need to do so that you don't get to the point where Dr. Joe or myself will have to write you tablets.
Yeah.
And what are these things that you need to do? Right. Let me just, try and summarize. We are living longer. The population is living longer, but we're also living longer with chronic ill health condition. I've heard my people say, oh God, please don't let us carry illness like handbag. When you're going, you carry your handbag with you. So chronic illness is regarded as a handbag illness. It's always there with you. But what do you have to do to prevent that? Does it interest you to know that up to 75% of people who go to see their GP, they go for health and lifestyle related condition? Dr. Joe, please, can you confirm or disprove? Up to 75% of people who go to see the GP, they go for diet and lifestyle related issues. And these are things that we can impact if we do things differently.
Yeah, that is so true. I mean, thank you for bringing that closer home, because the truth of the matter is, when I was asked to speak about men's health, the first thing that a lot of people will talk about is prostate, especially for men. And because that's the one thing that a lot of people get. But I realized that far more people, far more men come to us with diet, lifestyle issues every day. And 3/4, like I think that's about right. 3/4 of my consultations every day is about things that are lifestyle, diet related. About 75%. So that is absolutely spot on. And the truth of the matter is, why we are shining the light on this is that these things are actually preventable. If we take the right precautions, if we start, well, I met a gentleman. I like using case studies because sometimes when we give talks like this, it sounds distant, it sounds far-fetched. I'll give you 2 case studies. One is a lovely Asian chap, really lovely guy. At the age of 43, he gets a heart attack. And the sad part was when he was 41, I noticed that his cholesterol was high. So I called him in and had a conversation with him. It's sad, really. No, he was 43 and then I had a conversation with him. But at 45, about 2 years later, he ends up with a heart attack. The same tablets that he refused to have 2 years back, now he's having to take double the dose in order to stay alive. And he comes to me and says, Joe, I should have listened to you, you know? And see, most of us we're not, programmed to give out tablets. We don't want to be giving tablets unless we really need to. But the truth of the matter is that if you don't take the necessary precautions, then, another one was a 51-year-old man who he had a triple bypass. He had a heart attack. He needed to have surgery. And you know what he said? He said, I wish I had known what I know now earlier so that I can start taking those precautions earlier. So the moral really is that these things are actually preventable. And once we start heeding and walking in them, it's much easier to deal with.
Thank you, Dr. Joe. Let's go to the questions now. We're getting questions coming in. So I'd like to encourage everyone, please send your questions in. The first one is asking Dr. Joe, what suggestions would you give to people who sincerely struggle to lose weight despite following a healthy lifestyle?
That is a very, very, very good and common question. So the issue really then is to find out why are they struggling to lose weight. So first of all, we need to look at, are there genetic causes? If there are genetic causes, then we need to then up the ante, and I'll come to that. But then there could be an underlying problem. Could they have a thyroid problem? Could they have an underactive thyroid? Could it be that they have something else? So one of the things that I would encourage those people to do is to sign up with their GP, get a routine blood test, and get referred to a weight management program. There are loads of weight management programs scattered all around. We have them. There's tier 1 and there's tier 3. Tier 1 is the one that so different regions will have different forms of this weight management program. They'll help you look at your diet. So by and large, there are a number of things. I deliberately kept my talk very brief because if we start delving into each of these things, each of them is a talk on its own. I mean, hypertension, we can talk about hypertension on its own. Diabetes, we can talk about diabetes for a whole year and still not finish. But by and large, if you go to weight management program, they will help you look into your diet. You're not supposed to have portions that are greater than your fist because that's the size of your heart. They'll help you look into that. They'll help you look at how you process your food, when you eat the food. Because certain times of the day, like after 7 p.m., if you're over the age of 40, 45, you really shouldn't be eating anything heavy because our metabolism has slowed down and then it becomes more difficult for you to actually shed the weight. Also, sleep is a key factor. There's a lot of research coming up now that people who don't sleep long hours have a tendency to put on a lot of weight. Sleep disturbance plays and then it all leads into stress. If you are stressed and you're not relaxing, so the truth of the matter is that you have to go to a weight management program, and there's a 6-week, some of them 4 weeks, some of them 10 weeks, where they'll take you step by step. But the first thing is to rule out an underlying problem. Even if there's genetics in your family, there are tablets, medications, weight loss tablets, even weight loss surgery that is offered for some people. But most of us can lose weight by actually modifying our lifestyle. One of the key areas that is now being talked about, I think it's old now, but in the last 2 or 3 years, intermittent fasting is one of those areas where, people talk about how you can easily lose weight. But I'll leave that I'll leave room for more questions, because we could really go on a tangent with that.
Yeah, thank you so much, Dr. Joe. I believe people are listening carefully and taking notes so that they can do things differently to improve their health. Another question, or I think I'll pull two together. Someone's asking, are there any medications that predispose to the metabolic syndrome? And are there hereditary factors to this condition? So medication and hereditary factors, please.
Those are two different questions. So let's
Mm.
start with tablets that predispose to metabolic syndrome. No, see, metabolic syndrome itself is a risk. So there are some tablets that make you put on weight, sadly. And since at the beginning, Dr. Moji, you talked about the fact that, we shouldn't just talk about the men, let's talk about the women. I hear this a lot from especially the young women who tell me that certain contraceptive types cause them to put on weight. That is not true. The only contraceptive that is actually shown medically to make people gain weight is the depot injection, progesterone only depot injection. All the other forms of contraception do not make people put on weight. What they do is that they could alter your mood. And if you are the type that when you are sad, you eat, then you may well put on weight from there. I just thought I should chip that in. So going back to things that can make you put on weight, there are certain mental health medication that can cause you to put on weight. Antipsychotics, for example, antidepressants. One that comes to mind is mirtazapine. Mirtazapine is a good antidepressant used for anxiety. You take it at night, helps you sleep, but it also increases your appetite, and that way you can put on weight. Certain other mental health drugs can do that. There are a few drugs, yes, but they don't in itself cause metabolic. Don't forget that metabolic syndrome is a group of risks. So we're looking at risks. And the reason why I'm looking at risks is that prevention is often almost always better than cure. These things, I think if we don't pick anything up from today, this should be the mantra that all these things are better prevented rather. Now, going back to the second bit of the question, I think you asked about genetics. Now, genetics is complicated because genetics presents a predisposition. In other words, if something runs in your family, it simply means you are more likely to get it than other people. It doesn't mean you automatically, that's one side of genetics. There are other types of genetics where there's an inherited condition where you actually get it. So there are some chromosomal abnormalities like Turner syndrome and some other syndromes where you actually put on weight because of that condition. But most of the other genetic conditions are simply a predisposition. Talking about medication, people who are on steroids, long-term steroids for various reasons, kidney problems, COPD, steroids unfortunately cause weight gain. It's one of those things that can cause weight gain and therefore predispose you to metabolic syndrome. So that question is quite loaded and there's a lot that we can talk about there, but yeah, I hope that answered that.
Thank you very much, Dr. Joe. Thank you. Someone's asked a very interesting question, which I'm going to just throw in here, but I believe is another topic that you probably could give a talk on. So let's just try and nip it, but at least it will cause some, excitement. It's a question from social media. Someone's put in your comment about toxic masculinity. Yeah. And do you see this trend decreasing in younger patients?
Sadly, no. It's actually increasing in younger patients. So it's worse because of social media, I think. It's worse because of peer pressure. But I also think that because a lot of us now are trying to shine, not just me, but a lot of men's groups and many charities and even many GPs are shining a light on the fact that there's a drive. I don't know what other people do, but in my practice, we target the men specifically. We go all out to try and get the men to come in to have their health checks. We do opportunistic screening. You see a man, he comes in with his toe problem, we screen him for diabetes because they won't just come. So unfortunately, toxic masculinity, some of you may have heard about this rapper, Governor B, who himself struggled with depression. He's very well known in London. Londoners will know him. I see people calling in from Bristol. That's great stuff, good stuff there. So many of the younger men, unfortunately, because of the culture, the rap culture, the gang culture, and things like that, we're finding that they are actually, it's almost worse than the older generation. But also conversely, and forgive me, Generation X and Generation Z are more likely to come to the GP for flimsy reasons anyway. They'll come because, they are stressed out. Tesco doesn't have sliced bread. Man United is not winning. And so they'll come to the GPs. But if the GPs are smart, we can then use that as an opportunity. So it's two sides to a coin, really. I hope that sort of answers the question.
Right. So thank you very much for that also. Someone's put a question about whether there is a downside to taking statins and do they really help lower low density LDL cholesterol level? So that's
Is there a downside to statins? So yes, statins have side effects like every other medication. When you say downside, I assume you mean side effects. If it's not side effects, then the answer is no. If you mean side effects, then of course the answer is yes. Statins can cause muscle aches. Statins can cause joint pains. Statins can cause nausea. So statins can give some people rashes. So there are side effects, just like most medication. Even paracetamol can have side effects in certain people. It is, however, proven to be the most effective way to reduce cholesterol, including high and low density, including low density cholesterol. So when you take statins, it's almost dramatic. Within 6 months, the cholesterol levels begin to come down. So statins do work really, really well. Statins are cheap and effective. The NHS, I think, we love it. As a matter of fact, I think I was involved in a paper that was being drawn some time ago. It costs, well, it used to cost, I don't know after Brexit now, it used to cost about 17 or 17 pounds a whole year per patient for people to take statins. That's how cheap they were. Sorry, per month. What am I saying? Per year. Per month, £7 per month. So it doesn't cost the NHS anything, but it literally saves lives. I would encourage you. I have friends. I have a few friends that I treat personally, and I do private work sometimes, not so much these days. But when I have seen that their cholesterol levels are getting to a certain point, and they're not able to, for whatever reason, do diet and exercise, I always encourage them to go on statins, and they have not regretted it. There's a question here that I think is linked to this. He says, I am tiny, about 8 stone, and I have diabetes, and I've never been overweight. Why? I want to link this with statins because I have a good friend who lives on the other side of the pond, lives in Canada. I know he won't mind me using this. At the age of 43, he had a stroke. Why? His cholesterol levels were raised. He went to his family physician, family doctor, like they're called in Canada, and they told him that his cholesterol was raised, but he said, oh, I'll come back and I'll get it sorted. He traveled for business, ended up having a stroke outside of the country. Why was that? He had an inherited condition of raised cholesterol. He was skinny. He was half my size. So the person who is asking about being 8 stone and having diabetes, the first point I made about risk factors is genetics. Genetics plays a very, very, very important role. See, touch wood, I've divulged that there's diabetes in my family, there's hypertension in my family. I don't have any of that. Because deliberately, knowing that these things run in my family, I have made a conscious effort, not just with myself, with my brothers, but to make sure that you guys need to look after yourselves because this thing runs in our family. So if there is an inherited aspect of it, that means you have to put in more effort to make sure that that doesn't happen. It doesn't mean, that's why I said at the very beginning that, see, there are some genetic conditions that you don't have a choice, you get it. Like sickle cell, you just get it. But there are some other genetic conditions. I can't go into genetics today. That just, they predispose you. They make you more likely to get it. And that's what happens to a majority of us. If that is the case, we have to work harder to make sure that we don't fall into that category. And that's why you may be only 8 stone and have diabetes. Again, depending on the type of diabetes that you've had. Thank you. I hope that helps.
Yes, that's helpful information. Thank you, Dr. Joe. Would you be able to tell us, because someone is asking, how can you encourage our men, Black men, to talk about their health or mental health challenges and to take on board practices? How can we achieve that? That's one. Then there's a wife here who's saying that, how can I, help my husband to make the right decisions and pay more attention to his own health? So in a way, they're two parts of the same question in a way.
What was the first part again? Sorry.
No, that how can we encourage men, to be more forefront, to want to come to their GPs, to want to talk about their physical health or their mental health challenges? What can we do about that? There's a lady here who's saying that her son wouldn't go and speak to his GP, even though he's got these clearly, physical health condition in his chin, but he wouldn't even go to his GP.
Yeah, so it's difficult, to be honest. It is difficult. And that's why I said at the very beginning that this is one of the reasons why I actually picked this topic and targeted it towards men. Because if you notice, even in the chat, there are more women right now. There's about 100 of us on this presentation. There are a lot more women. And this is the same demographics that we find in our GP surgeries. It's almost like 3 to 1, sometimes 4 to 1. So men historically and characteristically do not like coming. See, first of all, you need to find a sympathetic ear. So you need to find a way to get them into, even if you have to go privately or go online, there are ways in which you can engage with your GP without engaging with your GP. So many of us have online, telephone, or even face-to-face, but it's a struggle. You have to keep pressing at it. The number of times, if I had a penny for the number of times for men who came and said to me, my wife or my sister or my daughter asked me to come today, you just have to nag them. This is one occasion where you're allowed to nag, ladies. This one time, get them to go to the GP. I have diagnosed several cancers. Yeah, please put it in the calendar. This is just the one time. This is the only occasion. Don't nag us when we're watching football. All right? That's not allowed. All right? Don't nag us when, we put our shoes wherever we want. Don't do that. Don't do that. If it's a health problem, please nag, because men do not like coming to see the doctor. So the number of times I have diagnosed skin cancers, I have diagnosed high blood pressure, it's almost like an epidemic. And that's why we love what Khan is doing and what Katib is trying to do in terms of targeted health improvement. There's a lot that still needs to be done. And Katib is, showing the way by helping us to shine a light on a lot of these things that, we struggle with. And it's a struggle. It's a big struggle. And it's a historic thing, but we have to keep pushing at it. The second part of the question was about the husband. Sorry, I didn't get that bit. What was the question again, Muji?
Well, he's saying specifically how she can encourage her husband to be more upfront about his health concerns. And can I just add that this is another my husband question. So that's one. The other my husband question is, the husband is in his 40s and he has a lot of belly fat.
Yeah.
He is slim elsewhere. Everywhere else, the husband is slim. His blood pressure and so on, they're all great. So they're asking, can you explain again the likelihood of health issues such as heart disease and excessive belly fat, and what can be done about it? I think this person joined late, so he missed some of that information. But the man, her man has belly fat, but everywhere else he's thin and his health parameters are normal for now.
Yeah, so just to recap, having a high waist circumference, so having a belly fat and an enlarged waist circumference on its own is a risk, it's an independent risk factor for having a heart attack or a stroke. The so-called apple shape, where you are slim and then you go big and then, So you need to reiterate to your man or to the men around you that this is not something that you should sit around doing. As a matter of fact, we found out when we were drawing up the risk stratification for COVID in Black ethnic minority, waist circumference actually played an important part in people who suffered with higher consequences of COVID infection. So it wasn't just COVID, so there's a theory behind it about the fact that increased belly fat increases the levels of circulating estrogens, which also then causes insulin resistance, which then causes all these other problems, which opens the door for heart attacks, for strokes, for even infection. So what you want to do in plain man's language, because I said that for the sake of those health professionals who may be on, you want to try and explain to them that being slim itself is not just good enough. Like I said at the very beginning, exercise, and then the waist circumference they are independent factors. This is why we're talking about this now, because a lot of time we make a lot of assumptions. We go by weight. Oh, my weight is not that big and all of that. But weight in terms of how are you measuring your weight? With what parameters? What's the comparison? Because if you put a Korean man and then you get someone like Francis Ngannou, the Cameroonian MMA champion, all right? They may be the same height, but their waist circumference is going to be very, very different. And so those things present an independent risk on their own. So I think it's really important. Please encourage your men. This is why we have these talks. Get them to listen to this talk. Send them to the YouTube page. Put notes in their sandwich. Pack their lunch for them. All right? No, seriously. I was listening to a program, and you ladies would probably like to hear this. I was listening to a program. The number of men that have been saved by women in their lives, whether it is the grandmother, the mother, the wives. Don't listen to men and say, they're this, they're that. The number of men that have been saved, it's like nearly 60% of all the men that come to, can't remember the exact figure, that come to get health check came because of a woman. So they may grumble now, they may even fight you, but they will thank you later. The case that I'd like to give is a young man. He's passed away, sadly. Is an Igbo chap from the eastern part of Nigeria. Let's just call him Mr. C. Mr. C was only 38 years old. He was overweight. When he came into my consulting room in Harpurhey, just here in Manchester, when he came to my consulting room, he came for something else. But when he came in, I noticed that he was panting. And from the consulting room to my room is not that much of a distance. Why are you panting? Now, I was like a couple of years older than him then. And I was like, dude, you just walked from here. He said, Doctor, now so we see him that whenever he walks short distances, he gets breathless. So I said, this is not good. There and then, I got him an appointment with our healthcare assistant, got some blood taken. Would you believe that 48 hours later, the lab rang us? I was the doctor on call, 6 p.m. They rang us and said, who is this patient? He needs to go to the hospital today. He was diabetic. He had low vitamin D. He had low iron. He didn't know. He was admitted. In fact, when he walked into hospital, North Manchester General, they grabbed him for 2 weeks. He was on admission. I don't know what happened. Somewhere along the line, he developed some complications, and sadly, he died. I don't want that for anybody. So you need to try and explain to the men that these things we're saying is not child's play. I had a guy, a pastor in Manchester, who developed hypertension, refused to take medication. Why am I saying that? Because Black people were very, very religious. And, many of you may not know, but I'm a pastor, all right? And so I can say this, and I'm not being racist or religionist or whatever else you want to say. This guy was a pastor, 45 years old, diagnosed with hypertension, refused to take medication for 2 years. We buried him 2 years ago. He's left 3 children and a young widow. Why? Why do we need to suffer these losses? Most of you don't see what we see. And that's why I do these sessions with a lot of passion, because literally it's a matter of life and death for some people. A lot of us will get away with a lot of stuff. It's like how Man United are getting away with losing matches here and there. A lot of us will get away with things. But when you look at the percentage of people who actually suffer consequences, it's not worth it. We're losing young men in their prime because the failure of attention. So this is a big deal. This is what you need to say to your husband. There's another guy, he was a doctor, 53 years old, hypertension, slumped in lung sight, came back from church. I don't know what was going on with him. He just slumped, slept on the couch, didn't wake up. So if you see what we see, maybe you need to tell your husband to come and have a chat with me, whoever that is. I give you an open ticket. Get in touch with the CAN team. Let me talk some fear of God into their lives. And maybe they should listen to this. So what I'm saying is that these things are really, really, really important. We play with our health, because there's council tax to be paid, there's road tax, there's this and that. And we forget that the greatest asset that you really have is this, your body. Once you are not there, you're not there. That's it. And, a lot of times we prioritize other things over our health. That's why I said, jocularly at the beginning, many of us look after our cars better than our bodies. Your car will get an MOT, will even get a service twice a year. Yet you, uncle, you will not go to the GP. You will not get health check because you are macho. May God help us.
Yeah.
Don't even get me started.
Yes, indeed. I mean, you've said lots of useful information, which I believe people are taking note of. I have heard that, especially, the belly fat, if you consider that your belly is only a few inches from your heart, you can understand how, when the belly fat is accumulating, it can easily affect the way the heart is working. So when you see someone, especially men or even women, once you start seeing that girth, that middle girth that is, sticking out, then know that that fat is not only in the stomach, it's also migrating slowly towards the heart. And that's what can cause trouble. But the good news, there's always good news as well. Recent studies have shown, so please, women, listen. And men, if you're on here, please listen. Recent studies have shown that men taking midday naps, they have reduced incidence of heart attack. So men who take, a little nap in the daytime, it is very useful for men. So they work long hours, just like Dr. Joe have talked, but they forget to take a nap in the afternoon or in the midday. Meanwhile, women would sometimes do that. So please, if you're on this forum, if you're taking nothing away for your men today, let them know that there's evidence that men who take naps in the daytime, they do have reduced incidence of heart attack. Thank you very much for bringing all the questions in.
Before we go, two naps, 30 to 45-minute naps in a week will reduce your risk of heart attacks by 68%. 2 naps in a week. So it's really, in fact, I didn't know. I've been doing it for years without even knowing, because the recent study came out about 6 months ago somewhere, 2 naps, 2 45-minute naps. The Japanese, one of the reasons why they live long, they take naps. 2 naps in a week for men will reduce your risk of heart attack by 68%. Somebody asked a question that the figure that I gave regarding Black ethnic minority, the figure, does it apply to Africans in Africa? Yes, it does. Because that particular study was done in the US and it looked at Black Americans in terms of as a race, not just in terms of the UK. Similar studies show the same thing in the UK and it's the same. One quick question here about the prostate. Some people believe that getting prostate screening affects their sex life. It does not. It's a blood test. It's a blood test. It does not affect. What may affect their sex life is if they have a prostate biopsy. Now, even a prostate biopsy does not necessarily affect your sex life unless they bungle it up or something goes wrong. So prostate screening is a simple blood test. Or you can even get an MRI scan, which is far more expensive and is not available often on the NHS. But a simple blood test will check your prostate and it doesn't affect your sex life. I don't think we'll be able to answer all the questions today like I thought, but that's why I was very if you notice, Moji, I was very, very broad in the way we presented it, because these things are things that on their own merit, each of these topics, we could really go to town on them. But I'd rather we brought questions, pertinent questions, so that we can look at it carefully. And somebody says that, maybe I support Man United. I don't know. It's just that those Red Devils, we are praying for them. They need to repent. Sorry, back to you, Moji.
Right. I hope people will take up Dr. Joe on his offer. He has said you should make appointments, bring your men to him so that I can take them for a drink and talk to them the way they understand, man to man. That way they'll be able to take steps to improve their health, physical and mental. Because remember, Dr. Joe has interest in mental health as well. He's a GP with special interest in mental health. So that's an open ticket for everyone on this platform. And I hope you'll be able to live up to it when these demands start coming.
They already come, Moji. They already come. You're relatively new to CAN. I've been around for about 3 years. The thing is, we have a counseling section in CAN that has been very active over the years. And so one of the things that we help to do is to, when people have queries, especially with regards to mental health now, they come in through the general inquiries, but then they get triaged by the counseling department. So we have trained counselors that are under the employ of CAN. And if there is now a specialist issue with that, I then look into it and decide if it needs a psychiatric input or if it's something that I as a GP can do. And we've dealt with many cases. Natasha has kindly put it up in the chat group there. So we have been seeing people. There is even we have an advocacy service for those who may have other domestic issues, domestic violence, immigration. There are lots of things different, because you see, what we often forget, all these things affect our overall health. If you are too stressed, if you're worried about so many other things, it's going to affect your mental health. It's going to affect your blood pressure. It may even affect the way you deal with things. So please, one of the messages today is, please go and get help. And if you're a woman here, encourage your man to get help. Women too. That's why I said at the very beginning that metabolic syndrome affects everybody. In fact, it's more common in women. But we are trying to focus on men today because us men are a bit recalcitrant and difficult to get to go to the surgery. I made mention about men having naps and cutting down their risks. Women are very good at having naps. So we don't need to talk about women having naps. They already have naps. But yeah, everybody, if you have a nap 2 to 3 times a week, it is your body needs rest. And we need to find clever ways of shutting down. Even though we work hard and long, we should also rest well as well.
Right. Thank you so much for that, Dr. Joe. I think in a sentence or two, the way I can wrap up, the essence of what has taken place, this health talk in the past hour, is that we should try and pay attention, if we haven't been, pay attention to the health triad. The health promotion triad, very simple. Your diet, sleep, and activity. I think if you can just note those and start working on them, your diet, your sleep, and your level of activity, then things will start looking a lot better with regards to health and the future. Especially the diet. I think the diet is just the top, because all these other parts of the world where people have been researched to live longer, a lot of the impact is because of what they eat, and it's dietary. So the takeaway message from me today is, you probably heard it somewhere, but I have read it and it just, I just had this lightning moment, like, wow. And it says, eat your food as medicine so that you don't have to eat medicine as food. So please eat your food as if you're eating medicine. Look for the healthy options. Look for the colorful foods. Look for the vegetables, the fruits, the fluids, the water. And try and avoid the 3 white poisons. Yeah, sugar, salt, and flour. I think even if you can avoid those three things for a start and just say going from today, avoid salt, sugar, and flour. You know, this flour in our food is doing a lot of damage to us. So the weight will drop off and it will add something good to your health altogether. So I'm left to just say a big thank you to Dr. Joe Omofua. Thank you very much. You have lived up to expectation because you have been passionate, you have been clear, you have been honest and transparent in the way in which you have shared this information with us. And we say a big thank you. And no doubt we will be having you again sometimes. We'll
Anytime.
just reserve that slot once a month or thereabout for you. And I just pray that you continue to have the grace to meet up to that expectation. And thank you all for our listeners. Thank you very much for staying with us again for this session with our Health Hour that's been put together by the Caribbean and African Health Network in partnership with our collaborators who are the following. There are 5 major big organizations who are continuing to sponsor and push forward health promotion in Black population: the Rafa International Agency, the Croydon BME Forum, the Royal Assembly RCCG Sheffield, and the Black Health Initiative. We really appreciate your contribution. Thank you very much to our listeners. I'm going to hand over now to Stephen to give us updates on announcements. Thank you.
Thank you very much, Dr. Joe. For some reasons, I don't know, my camera has refused to come on for that very interesting session of addressing pertinent concerns on men's health. Thank you very much. And thank you, Dr. Moji, for hosting us today again. Just before we wrap up completely, I want to just bring you some information. Just bear with me and share my screen. Right. So our next Creative Health Hour session will take place again next week. Do want to tune in to benefit from the expertise of our doctors. And the topic for next week will be vaccination and winter health. And it's on the 18th November 2023 by 11 a.m. to 12:15 p.m. Do register on our email info@can.org.uk or visit www.portals.can.org.uk/health hour. And taking care just has been mentioned over and over by our doctors. Taking care of your health starts with your diet, just as Dr. Moji have said, and physical activities, just reiterating what Dr. Joe has also emphasized on. So therefore, we urge you and enjoy you to join our next Healthy Heart session, which is on Tuesday, 14th November 2023 by 6 p.m. to 8 p.m. And the topic will be Ask the Dietitian. And the host will be Dr. Hiba Osekwasi, who is a registered nutritionist, and a guest speaker, Alistair Kumi, and Quariera Simpson, a registered dietitian. I also have a physical instructor, Orlando Grant. We want to also invite you to donate to support those who are desperately in need of help, and your donation would go a long way to increase capacity of CAN advocacy service. The action you take today would improve someone's life. QR code is just on the screen. Kindly scan the QR code to donate. Sorry, for some reason my computer is hanging. Join our transformative SFSC Stronger Relationship Program to duration of 13 weeks, free light meal provided, crèche for under 3F, and it's free in-person course. And location is at Denmark Road Sports Center, Manchester at M6 FG. And the dates starting from on the 19th of January 2024 from 10 a.m. to 1 p.m. CAN's Family and Advocacy Session have the purpose to address the issues that are faced by the family and individuals of the Caribbean and African community. And on the 15th of November 2023, the topic is domestic abuse and its impact on children and young people. Our guest speaker will be Sandra Johnson, who is the Children Domestic Abuse Support Service. And to register, kindly scan the QR code below or contact us at 0771 0022 382 or email advocacy@can.org.uk. Are you at risk of type 2 diabetes? Individuals of Black ethnic are more at risk of type 2 diabetes. And just also, as Dr. Joe has also emphasized today, understand your risk factor and get texted. The QR code is just on the screen. Do well to scan below, or you can visit the website just on the screen. Are you ready for a career change? The Trinity University offer nursing program. So therefore, do well to share this across your friends, relative, family who might be interested in getting on this program. The QR code again is on the screen. And CAN has been able to bring you this interesting CATIP session in partnership with RAFA International Development and Cradon BME Forum, MF Caribbean Association, Black Health Initiative, and the Redeemed Christian Church of God, Sheffield. Right. I think at this point, I'll say thank you for joining us today, and we do hope to see you next week. And I'll hand over to Natasha.
Hello, I just wanted to again thank you all for being here. Thank you, Stephen. Thank you, Dr. Moji. Thank you, Dr. Joe. What a great team today. We always have great teams in, but today was special. I just wanted to quickly invite you all to CAN's Carol service in this upcoming 4th of December at the Manchester Cathedral. We will share further information on our social media in the next half hour, in our e-bulletins, but we just wanted to, we will be hosting a free event at the Manchester Cathedral in the 4th of December in the evening. So do come to our Christmas Carol event. There will be, many other partners across the community will be part of as well. Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.